I'm at J&J. I'm with David Daughtrey. He is the Business Director of Education and Healthcare. David, it's great to have you with us.
Thank you for coming in today, Dave. Appreciate it.
Well, there's a lot of things I want to learn. I've been intrigued by some of the products that you're offering, and I want to get into that. But first, talk about the areas that you concentrate on, education and healthcare. What's happening in those sectors? Are we seeing reasonable increases in business?
Not to this point. Matter of fact, education, if you look at it and divide it up into subsegments, K through 12, especially public, is very fiscally challenged, and there's a very good reason for that. If you look at most public education, they get most of their funding from state and local government, and that funding has been impacted by loss of revenue due to taxation. So you have school systems that are trying to do everything they're supposed to do to run a school, but with a lot less money. So that's one of their biggest challenges. Colleges have seen a decline in enrollment over the last couple of years, not because people don't like colleges, but when you have the downturn in the economy, the Great Recession from 2007 to 2009, a lot of people went back to school. Either they were displaced in the workforce or they went to a technical college to pick up on something they could immediately turn into income within a short span of time. So those folks have come and gone and graduated. So now you see a slight decline in the student population. And so you have colleges and universities now who are striving to figure out how do I recruit, how do I get students, how do I get the better students. And the same point in time, the state colleges anyway they get some of their funding from state tax dollars, so they're subject to the same issues that a K through 12 is. Community colleges have all been devastated because so much of their funding comes from state colleges, and obviously tuition too, but it gives them a simple issue. If you can't go up on your tuition and you're not getting tax state funding, then where do you go to increase your funding? If you look at the healthcare segment, you've got the acute care healthcare, and you have senior living, long-term assisted living. And in the acute care segment, their biggest issue is how to deal with the reform going on in healthcare. And it's been a couple of years now, but they're still trying to figure it out, and how they get paid. And even the best-run for-profit hospital finds it difficult to make even a 3% margin. And people find that difficult to believe, but it's expensive to run a hospital, and it's highly competitive to run a hospital. So that's one of their biggest challenges. In senior living, they're trying to figure out how to prepare for the onslaught of the baby boomers. There's some 70 million of these, and right now there's 1 million persons in senior living and assisted living facilities, and that number is going to double and quadruple in the coming years, and they've got to figure out how they're going to build, manage, and take care of these people.
So I guess the long and the short of it is there's a lot of ugly carpet out there, I suppose.
There probably is.
And I suppose what that means, people always talk about pent-up demand, and I suppose when the economy picks up, you're going to be a busy guy, I suppose, at least in terms of the educational sector.
We're seeing some of that right now from pent-up demand. It's not huge, but yeah, you can't. And on campuses also, because when you think about a campus, it's a small city, and there's administrative buildings, and there's medical buildings, and there's hospitality, there's hotels where they use for academic and athletic recruitment. So a lot of when they're trying to recruit students and their parents, when they come on campus, they have to have a certain aesthetic. So they're getting around to it sooner than later.
So that must mean that, okay, we've got to clean up the carpet, put down some new carpet, impress the moms and dads, so Junior will come here.
That's it.
I see. Well, that's interesting. In the healthcare arena, you mentioned Obamacare. And I guess in all sectors of the economy, it's thrown a wrench, it would seem to me. People don't know what to expect. Costs are going up. What are your thoughts there? I mean, do you have a positive feeling that next year, the year after, or at some point in the future, things will even out and business will be better?
We're thinking that. There's no proof of that, but we're hopefully optimistic. I think it's been 2 years, so I think people are trying still to come to grips with what it means. But from our perspective, we do know that the Affordable Care Act The reforms are changing the emphasis from volume driven to value driven. It's very reimbursement based. And as hospitals are based on that type of performance, it goes into a lot of other arenas. For example, you have the HCAHPS exit interviews, and how a hospital may be paid, how a doctor is paid, how they're valued or judged is on those exit interviews. And if you look at some of the questions, they're very ambiguous. And you, as a patient, could be just having a bad day and answer them in such a manner that it may cost the hospital maybe up to 1% of their Medicaid reimbursement. Then again, if they get a positive, result from the surveys, it can be a positive financial return. So the hospitals are very aware of this. So they're trying to figure out what that means within their facilities, not only how they treat their patients, but the facility itself and how it plays into this.
Interesting. But the bottom line would seem there's a lot less money around to buy carpet and other furnishings, and that doesn't bode well for anybody in the carpet business.
Well, you look at acute care, and some time ago, really back in the 80s with the advent of the AIDS virus, when people thought it could live outside the body, up until then, you could go to a hospital and you could see it in the corridors and even patient rooms and places like that. So that's the first reason it got taken out. And so it's certainly largely a hard surface area. But I think what's challenging to administrators now is, for example, on an HCAHPS interview, if someone exits and surveys and said, I had my procedure, my operation, you told me to get rest and get well. I can't get rest and get well because the hospital's a noisy environment, and just by nature it is. So they're trying to figure out, what do we do about this? Because otherwise it's going to have negative survey results, and therefore negative economic impact. So that may be fabric on the walls, it may be acoustical ceiling tiles, it may be a surface on the floor that can absorb sound. So that's how they're looking at all this. And they're very careful in their decision making, and what used to be in a meeting you'd go to and there may be 3 or 4 participants, facilities person, maybe someone from the nursing staff, someone from maintenance. I was at a hospital recently in Ohio and there was 35 people, including the president.
Really?
Yes, sir. If they're going to make an investment, they're going to make sure that it works, and they do it the first time.
So that really bodes well for you, I would think.
For the manufacturers that understand, it's not just about aesthetics, but it's about performance and meeting the needs of the facility and what those needs are. It does bode well.
Mm-hmm. The sound aspect. Mm-hmm. I mean, everybody's been in a hospital, and it is a pretty noisy place. Is that one of the things that some of these 30-some-odd people ask you about was sound? Was that something that came up?
They were concerned with sound absorption, rather. They were concerned about slip fall issues for staff and for patients. You can imagine if you're staff, you're there X many hours in a day. If you're a patient, you're typically coming off some sort of procedure or surgery. And in most cases, what do they tell you to do? They want to get you up and walk. Well, you certainly don't have full control of your facilities, your faculties. So you're going to, you're at risk anyway. And then on let's say a hard surface floor covering, and if there's anything like incontinence or a spillage in the floor going on, it just exacerbates that situation. So those are some of the things they want to know. And they want to know if they could clean it. That's the biggest issue with soft surface in a healthcare setting is, can we clean it, because we roll a lot of crowds, and roller mobility. Those were their main issues.
Is that the same situation? Are they concerned about maintenance in the educational arena?
Very much so. And where you see hard surface taking share in education, it's mainly in K through 12. And it's for that reason. The perception is we can't keep it clean. The true reality is you can clean it just as well as you can any other hard surface. It's just that they choose not to or they don't do it as often. And therefore, then you have the resulting factor of the appearance of it doesn't look clean. So the easy answer for some of these facilities is let's take it out and we'll do hard surface.